Hello, my name is Olivia Silkwood. Just a few notes before we get started. This presentation is intended for my fellow center managers, my direct supervisor, our director of operations, and our VP of patient services. Okay, so let's get started. Thank you so much for taking the time to review my presentation. I'm going to be giving you a very quick overview of the visits for Family First. The main goal of our health center is to increase our patients' visits, increase our provider productivity while still maintaining the best possible care for our patients. Back in 2023, Family First lost a significant amount of their providers. And since then, we've been trying our hardest to rehire, retrain, and recoup some of those visits. With our current providers, we have had to deal with a lack of regional floats and affiliate floats. So when our providers have been off on vacation or have been out sick, it has been extremely difficult for us to find providers to cover them. And just some quick numbers here with the amount of vacation plus sick days since January, it's about 1,300 visits that we have missed because of the lack of coverage. We have been doing our best to manage that by reaching out to other health centers, to reaching out. I have reached out to talent management to increase our recruitment efforts to fill our open positions. We currently have one open RN position. Our lead clinician position is still open. We were able to fill our family medicine position with a full-time doctor. She will be starting full-time 5 days a week in November. So our demand, our patient demand is there just by looking at their next available appointment report. Our affiliate goal for all patient services is under 5 days. The highest their next available is in our patient services, our reproductive health. We're at 20 days. RN is at 10, and our prenatal is at 10. And this is really just due to the lack of provider coverage that we have. So my plan is I am going to check our visits every day. I'm going to compare that to our projections. I'm going to communicate that to our staff so they have an understanding of where we're at for our daily and monthly projections. I'm also going to look at our schedule every day and see where we can add more visits. The front office has been instructed to communicate with the back office if there are any walk-ins. They are going to inquire about the provider's schedule, if the provider is on time, and if they are able to take a walk-in. Every week, I meet with our template specialists. We review the schedule. We review by provider to see where we can add more appointments. We confirm that our schedule is correct, and we look for missed opportunities. Every month, I review this information with our staff at our monthly staff meeting. I want to be completely transparent with everyone, my medical assistants and my providers. I want everyone to know where we're at and what we are trying to accomplish, which is 26 patients per day per provider for reproductive health and 18 patients for our family medicine. At our staff meetings, I also ask our staff for any ideas and thoughts and suggestions in order to improve our flow, improve our schedule, and how we can make the most of what we have in terms of staff. I am also working with talent management to recruit our open positions of the lead clinician and nurse practitioner. I have also opened Family First up to any training. So if we have a clinician that needs any training, I have offered Family First and our staff to help in that process. And I've actually been able to get around 200 extra visits just from being open to this training. Hopefully by next year, we will have all of our providers fully trained and we will have 4 nurse practitioners that are full-time, 40 hours a week at 1 FTE, and our family medicine physician will also be at 40 hours, 1 FTE. So the combined total of all of our providers could potentially put Family First at over 2,000 visits per month. I think we are fully ready and capable of seeing over 2,000 patients per month with the staff that we have. Despite some of our challenges, we have been able to close the gap by less than 100 visits in the month of August. So we have been using all of our patient care standards, all of our guidelines, our confirmation calls, our double bookings, accepting walk-ins, and open lines of communication have really helped us increase our visits. So I'm very excited for next year and everything that we can accomplish. I'm really going to push all my staff and myself to meet or exceed our projections. I am open to any questions that you have. You have my email or my phone number. If you think of something else, please reach out to me. I'm happy to discuss our visits in greater detail. Thank you so much for your time.